we're saying that we'd focus on vulnerability, and we've not changed that. But one person's vulnerability is perhaps different to another person's vulnerability. Actually, our definition of vulnerability may even be different. Holistic safety and well-being, as a mouthful. I think I know what it means from a personal perspective. I suspect we've probably got a number of determinations of that. And again, I think it's one of the questions we need to be asking ourselves about where we place ourselves and what that really means for the future. 8 times more likely to die if you're over 80 than if you're 50. But actually, you're less likely to have a fire. So that's even skewed further to some degree. Men, particularly bad. We start to become higher risk around 50, women around 60, and they don't climb as sharply as us. There is an alternate graph that Errol will show later. This is purely fire. There's a U-shaped version of this, actually, that involves young people. But from a fire perspective, we've nailed it. We don't, because we won't see that many young people die in fires anymore. It is the older generation. So they are a massive target audience for us, and lots of services target older people. Funnily enough, they're a big target audience for health. And why is it a big issue? We all know this. The aging time bomb is one of the things that, health, actually social care, we're going to double the number of older people by 2050.
You don't hear the public health professionals talk about accidents very much. And yet, they are the 5th biggest cause, single biggest cause of death, full stop. They are the leading cause of death up to age 39. They're the leading cause of preventable years of life lost. So they are a very significant issue. Now, if you look at the numbers slightly differently, so if we just focus on fatal accidents, what we've done is we've split out fatal accidents in terms of road traffic accidents, primarily in terms of transport, and then home and leisure, which accounts for the bulk of all the other fatalities. And you can see that basic accidents are a problem amongst the elderly. So this theme of young people being incredibly accident prone, this graph maybe sort of calls into doubt. So across the top, we've got about 391 children who die because of an accident. Then people of working age, us, you've got 4,300. And then in retirement, that's where things go horribly wrong, and we've got over half of fatal accidents actually amongst older people. Thank goodness the FRS is actually starting to focus on this issue, because no one else is, quite frankly, apart from Little Rosper with its 100 or so staff. I mean, the FRS potentially is a phenomenal force for good, so that's why I'm such a fan, as Lewis is saying, of what you guys do in the community. Because my goodness, there's a huge task out there to be done. But what we do know is that there's an awful lot that we can do that works really well. And okay, that's a picture of, I've dragged it out of the archives, Tufty and Willy Weasel with a fire engine and obviously Fireman Sam. Because quite frankly, this is all about partnership working, and I think that's a lot of the theme that we're talking about today. But we know that within road safety, the 3Es have worked brilliantly over decades. Well, quite frankly, the same approach can apply in all sorts of areas of road safety. We know that targeted interventions work really well. We've got a history of success in terms of achieving big reductions in injury rates. Now we've got this whole story of how we use social media, and the big challenge is actually to encourage people to do the right thing. So just some final little thoughts. 7 million patients attend A&E due to unintentional injuries. So working for ROSPA, the Royal Society for Prevention of Accidents, I'm not interested in other reasons for attending A&E. Sorry, but I've got to, 7 million is a big enough challenge as it is. It costs about £1 billion a year to actually treat those injuries, and that's about the same as it costs to actually run A&E departments full stop. So my goodness, there's a huge opportunity in terms of just making a small improvement, a small reduction in those injury rates, and how much the NHS can save. And I suppose the big challenge that we all face is actually taking some of that saving and actually reinvesting it in prevention through organisations such as the FRS. Thank you very much.